So remember something I've said many times before. If you have no bladder symptoms, nothing bladder, no urgency, no frequency, nothing, do not give your urine to the doctor for analysis. Do not, because you'll be wrongly treated for a condition that you don't even have. And then you'll be suffering, the consequences of that medication. But let's say if you have irritative bladder symptoms such as urgency and frequency, and you go to the doctor, they dip the urine, everything else is negative, but it shows blood. Now what do? Now you don't have any blood, you are not bleeding, you're not in your menses, and you don't see blood, but that's microscopic. So what can be done? Now there are two schools of thought. One is that you can send it out for analysis, and under the microscope they can look for how many red blood cells are present in a high power field. If it is more than 3 red blood cells in a high power field, then that constitutes microscopic hematuria, or heme, blood in the urine. So microscopic blood in the urine, which is asymptomatic. That means you don't have any complaints, and it's an asymptomatic, no complaints, microscopic blood in the urine. That's what this condition, asymptomatic microscopic hematuria, means. However, in some cases, I may not just wait to send the urine out. If it is positive for blood, I look at the patient, see the history. If she's over the age of 60, she's a smoker, or she has a family history of bladder cancer, I will immediately look in the bladder at least and make sure that there is nothing going on in the bladder. We may not do any kidney assessment, and we can wait on that. But at least a simple test can be done, or even a kidney imaging can be done if there is a strong family history or strong history that you want to rule out a bladder cancer or something to that effect, or kidney or urothelial cancer. So blood in the urine doesn't mean bad. It just means that it needs to be assessed. It cannot be ignored.